Well, Happy New Year 2025. This is the January edition of One Man's Meat is Another Man's Poison podcast on YouTube. If you're just joining, please go to the previous 14 podcasts for a novel learning experience. I'm Dr. Joy Odimegu, a herbal medicine expert. As promised, I will dedicate more time to discussing the misuse and abuse of herbal or natural medicines. This is actually by popular demand. So, when we talk about misuse of herbal medicines, we refer to overuse, underuse, and inappropriate use. These are all common because people believe that they are natural, herbal medicines are natural, so no harm can be done. And we know that this is not true. An instance of overuse is when someone is using bitter leaf juice for digestive issues. It's actually quite effective for that. And the recommended dosage is 2 medium-sized leaves squeezed in 500 mils of water. The person decides to squeeze 5 to 10 leaves because more is better. Not true. More is fatal, actually. So this leads to poisoning of the system because the toxins in the bitter leaf, which are phytochemicals like tannins and uh, saponins, they accumulate in the system and they're not supposed to be there. And one may not feel bad immediately, but this accumulation over time, one day something goes wrong. Another common example of overuse is with aloe vera. While aloe vera is often used topically for skin burns or even is taken orally, also for digestive issues, its misuse occurs when people consume it in excess, especially the latex of the skin, which is a bit yellowish. This can lead to diarrhea, dehydration, and kidney damage. Underuse can happen through adding the herbal medicine that one knows that it should be boiled, but then one feels, okay, hot water is similar to boiling. No, putting in hot water is very different from boiling. And this can happen with ginger. So you put in hot water and then you drink, but you are not getting the fullness of the ginger phytochemicals. So it's necessary to boil so that those phytochemicals will be extracted. It will dissolve in the boiling water, and then you sip after boiling to get the fullness. So this is underuse of herbal medicines. Then inappropriate use of herbal medicines occurs when one may be required to mix two herbs because they work in synergy with each other. A typical example, I can explain this, we call it bioavailability. One makes one more bioavailable. So I explain this with turmeric and black pepper. Black pepper is often used with turmeric because it contains piperine, a compound that can increase the absorption of curcumin, the active ingredient in turmeric. So it's necessary to add a small quantity of black pepper in the herbal mixtures containing turmeric. Many people are not aware of this, and this is using turmeric inappropriately. Another aspect of herbal medicine misuse involves self-diagnosing and treating. You know, we feel somehow, feel bad, and then we self-diagnose what the problem is and we start treating ourselves. That is wrong. It's necessary to consult a doctor, get the proper diagnosis, and discuss options for treatment. Then another misuse of herbal medicines is inappropriate combinations. Mixing herbal medicines with other drugs or supplements without professional advice can cause harmful interactions. There are so many studies on this because doctors have started noticing weird reactions in their patients, and they found out that the patients were mixing orthodox and herbal medicines. This is a no. An example is garlic. Though garlic is often used for its health benefits, it's very powerful as a lowering blood pressure lowering drug. Some people misuse it in large quantities or in the form of supplements, leading to blood thinning, digestive issues, or interactions with medications like blood thinners or diabetes drugs. There's actually a difference when someone consumes garlic in food compared to when it's consumed alone as medicine. This is actually my mantra. Finally, misuse by disregarding contraindications. It's necessary to consider one's personal health conditions, such as allergies, pre-existing medical conditions, or pregnancy, before consuming certain herbal medicines, because they may not be good for one situation at that point in time. It's necessary to consult a herbal specialist, a medical doctor, or a health practitioner for help to go the right way. So I'll continue with abuse of herbal medicines in our next episode. Thank you so much for listening. Keep listening, keep commenting, keep the questions coming. Bye for now.